Much for tuning to our channel today, and I appreciate you taking time this morning to visit us. And I want to discuss this morning Molluscum Contagiosum. It's a very common viral disease. Before I go further, I request you to visit our website at www.drpaul.org. That is www.drpaul.org, where we posted hundreds of videos for patients, physicians, for students preparing for USMLE and PLAB examinations. So please take some time to visit us today. So Molluscum contagiosum, it's a viral infection. It's characterized by pearly papules which are flesh-colored and which have central umbilication. That's an important point. Central umbilication is characteristic of Molluscum contagiosum. So it's caused by Molluscum contagiosum virus, a member of the DNA pox virus group, and it is common in children and young adults. And it is usually transmitted by sexual and often even by close contact. So when people come close to each other, whether sexual contact or other means, they get these dome-shaped, flesh-colored pearly papules with the central umbilication. And you are seeing a patient with Molluscum contagiosum. And the central umbilication may not be present in all lesions, but in the questions you always see that term. And if the lesion of the Molluscum contagiosum is inside, you will see a central waxy core. So central umbilication and waxy core, these two terms, ladies and gentlemen, they are characteristic of Molluscum contagiosum. Lesions are most often asymptomatic and may not be pruritic. They are most often located in the pubic area and proximal and medial thighs, sometimes even in genital organs like a penile shaft, and they may become more numerous in patients who are especially immunosuppressed. But in immunocompetent patients, they may just stay like that, and patients may not even need treatment. Now, Molluscum contagiosum, as I said, these two characteristics, remember them, they're very, very important. The central umbilication and a waxy core. So if you biopsy them, they feel like a waxy core inside, and that is actually useful in differential diagnosis. And if you take, for example, a histological slide, and you will see the eosinophilic inclusion bodies with epidermal cells. So eosinophilic epidermal cells, so you see them on biopsy and histology, but you don't even go that far because most often you look them and you diagnose them. Even patients will tell you it looks like a Molluscum contagiosum. Now, differential diagnosis, sometimes it might look like vesicles and herpes simplex, and sometimes in immunosuppressed people it may look like histoplasmosis or cryptococcosis or basal cell carcinoma, squamous cell carcinoma. All kinds of things might come into mind, but as I said, go by the characteristic features of Molluscum contagiosum and you will make the diagnosis. Now, what about treatment? Treatment based on the patient. For example, if the patient is immunocompetent, and he doesn't have to worry about it because Molluscum contagiosum is a self-limiting condition. But if the patient says, well, I don't want this ugly lesion on my body, then you can actually treat them. And what about immunosuppressed patients? Immunosuppressed patients are the patients with deficient immunity, and these patients definitely need treatment. And the treatment requires either destructive treatment or immunomodulatory treatment. Molluscum contagiosum can be effectively with the curettage followed by incision, and then you express that central waxy core. We call it molluscum body. So curettage and incision, you can do electrosurgery or cryotherapy, and you can even try cantharidin. But cantharidin causes a lot of pain and it can cause blisters. So cantharidin should not be applied if the patient has, for example, in genital area and a penile shaft or vaginal wall. You should not use cantharidin in those areas. The other agents, imiquimod, applied 3 times a week overnight, and the patient gets good clearance with imiquimod. You can also try podophyllin. Called as a podophylax 0.5%, and laser therapy. Another agent is trichloroacetic acid. You can try those methods for Molluscum Contagiosum. So all these modalities, incision curettage and electrotherapy and laser therapy, imiquimod, trichloroacetic acid, podophyllin, all these can be used in these patients. So basically remember the important points, and those are very important to remember. And remember, it's a self-limited condition in immunocompetent patients, and a condition that should be treated in immunosuppressive patients. That's about Molluscum contagiosum. If you feel free to post your comments, and if you know any other essential points, please type them in our comment section. Thank you very much. Visit us at www.drpaul.org for hundreds of medical videos. Thank you very much.